we are routinely running out of physical beds to care for all patients, both COVID and non-COVID, who need our help. The minute a bed opens, a patient is waiting in our ER to fill that bed, or it's already been promised to a patient waiting in another hospital to be transferred. And I know this is the case at other hospitals in the state as well. Mercy is a large health system with hospitals and clinics across a 4-state region. We have hospitals and communities all across the state. Patients at our rural hospitals from Watonga to Tishomingo can't even get into our Oklahoma City hospital. The providers in these rural communities are calling around to every hospital in the state and ultimately sending our patients, our Oklahoma neighbors, to Kansas, Texas, and Colorado when they are able to find an open bed there.
Things have changed from the first wave of the pandemic that we saw in 2020 and early 2021. The most important change is that we do not have the staffing levels available to care for patients that we had a year ago. This is hard work with a large number of patients needing an unprecedented amount of care. COVID-19 puts our caregivers at risk, not only at work, but also out in the community. Sustained risk, fatigue, and trauma have contributed to an existing medical staffing crisis statewide.
Many women are scared, women who are pregnant or who want to become pregnant. As an exhausted mother of 2, I would never stand here and recommend a vaccine that had any evidence of affecting your unborn children or your ability to have them. These vaccines are safe and frankly protect pregnant women who are all at high risk for severe illness with COVID. Our bodies change in ways when we are pregnant that makes us more vulnerable to this deadly virus. We know now from tracking the data since 2020, unvaccinated pregnant women who get COVID are more likely to require ICU care, to need a ventilator to breathe, and are at increased risk of dying from COVID. And we know now from following more than 114,000 women who were pregnant and got the vaccine, there are no increased risks of stillbirth, birth defects, or loss of pregnancy.
Getting the vaccine is your civic responsibility to protect the people around you. Because if you're not spreading the virus, other people don't get infected. It's important for you with your children. This is a virus. It's not a political issue. It doesn't, follow state lines, political divisions, or anything else. It's just a virus, and it's mutated. And it may mutate more if we don't get it stopped. Hospitals and our healthcare providers are doing everything they possibly can to take care of our patients, but Dr. Watson made the point that there are so many people who get sick with COVID, end up in the hospital and say, either I wish I'd taken the vaccine or can you give it to me now? It's too late.
For more information, you can visit tulsaworld.com.